There's a desperate need for convalescent plasma donors to help COVID-19 patients fighting for their lives. In fact, at one center in Texas, the demand is 4 times the supply. And as Allie Spilliards reports, they're now asking for help solving the shortage.
They're the desperate pleas we've heard since March.
Every morning I get up and I haven't had a call from the hospital, and I thank God that he's alive one more day.
North Texas families seeking convalescent plasma donations from someone recovered from COVID-19 for a loved one still suffering. In the months since, we've witnessed the triumphs like Jose Martinez.
Joy, a lot of joy and gratefulness.
Meeting the man whose antibodies helped save his life. But with hospitalizations near record highs, there's simply not enough.
We are desperate for it.
Kiani Holloman with Carter Blood Care says DFW hospitals currently need about 125 more units each day than they can provide.
The need and demand is going up. In fact, I believe the demand is 4 times right now than it was when we originally started the convalescent plasma program.
Though the number of those eligible to give grows, she said they worry those who weren't hospitalized may not know. People like Megan Michelson.
I thought it was a sinus infection.
Who almost didn't know she'd been positive until lingering migraines prompted an antibody test, putting her in a position to help.
For me to have that experience and then for other people to be in the hospital or on ventilators, I mean, I am so grateful and so thankful that my experience wasn't that.
As cases grow, Holloman says they're having to rely on outside resources, shipping in plasma from New York. But they hope stories like Michelson's
It wasn't painful.
Can convince more North Texans to help their own.
Just going out of my way a little bit could save someone's life.
COVID-19 survivors may experience heart issues even after they've recovered. 2 new studies out of Germany suggest patients may experience inflammation in the heart. 60% of patients in the first study had ongoing myocardial inflammation. The other study evaluated the autopsies of coronavirus patients and found about half had coronavirus inside their heart tissue.